In your training, maybe could you talk about a little bit about the protocol to minimize side effects? Because just from what I've seen, treating patients with semaglutide and other, what might be called medically directed weight loss solutions, what I see is that there's a certain way that you can approach it that can minimize side effects. And then what I've seen on the expert witness side from people that are in trouble is that many times, I've seen everything from people basically saying, hey, here's the vial, here's some syringes, here's a piece of paper, take this piece of paper and that's your dosing guideline. And you're giving this to an untrained patient who's like trying to figure out even how to draw up the amounts that are on the paper because they're unfamiliar with how to draw up medications, right? Everybody's crossing their fingers that they don't overdose, because they don't know how to draw it up, or they even know how to read when you put down, so many mLs, they understand how that actually translates into their syringe. It's amazing.
Right. Yeah. So I think there are a couple different ways we address that. I mean, one obviously is the face-to-face patient education that happens during that initial meeting when they're starting the program. They've paid, you've screened them, they were a good candidate, they're coming in for that first appointment where you do a very good job of actually teaching them on site how to draw up the medication, how to read the markers on the syringe, how to do the injection themselves, where to pinch, what to pinch, when to let go, all the things, right? It's also important that that is documented and that they leave with a document that they understand that explains everything that you just taught them, but it can't end there. Okay, like there needs to be a continual flow of communication during the time they're in. We do a 90-day program and then 90-day cycles. So during the time that they're in that 90-day cycle, we need to make sure that we do make sure that there are scheduled check-ins where they're communicating with a medical professional about everything that's going on. And then, of course, they're also on a very gradual ramping up of the medication as they're going that is dictated by the medical professional, whether it's, Jen or one of our other providers that is doing the check-ins with them. So, we definitely don't do all of the injections for them. We don't have them come in every week, but we are talking with them and coaching them every week via telemedicine to make sure that their dosing is correct, that they're not experiencing any adverse side effects, that they're ramping up appropriately, that they are, getting all the hydration, the right nutrition, the right body movement, all of those things. So there has to be, not just the education and the assets that they leave with, but that continuation of the relationship through that journey. And that's what's really going to limit side effects and also make them the most successful. We just found that doing it via telemedicine was significantly more efficient than trying to have in-office scheduled visits on the weekly basis.